Many people believe that a sight test and an eye exam is the same thing, but it's absolutely not. A sight test just checks the numbers in your glasses. It has nothing to do with the health of your eye. So it does not check if you have glaucoma, age-related macular degeneration, or even any anterior eye diseases in your eye. So it's very, very important that everyone goes for a full eye health exam rather than just a sight test. In a full eye health exam, we will be doing many tests, such as a glaucoma test, where we put a puff of air onto your eye and check that the pressures are okay. We also do something called the visual field exam, where we test your peripheral vision to make sure that there's no neurological disorders, a retinal detachment, or even the beginnings of glaucoma. We also take a photograph of the back of your eye so we can show you that everything is healthy and keep that on record to make sure if anything is changing, we're able to show you that next time. So as an optometrist, we will talk to you about your visual needs, right? We'll also discuss your health. So if you are a diabetic or you do have high blood pressure or any family history even of even amblyopia or any other eye problems. The next thing we do a binocular vision assessment, which means that we're making sure that the eyes are working together. We're also going to do an assessment of the pupils, where we're checking for any neurological involvement between the eye and the brain. After that, I'll have a look at the back of the eye myself. Even though we do photograph of it, it's nice to have a 3D view of it. So I do that with the ophthalmoscope. And then I also do a check of the anterior eye, which means the front portion of the eye. So your conjunctiva, your lids, your lashes, and your cornea, to make sure that's nice and healthy. And then we finish up with checking the vision of the eye. And then we sum up and I talk to you about what we need to do to maintain eye health, educate you on how we can continue to, make sure your eyes are healthy for next time. Eye exams start as early as 6 months of age, and they're free from the age of 0 to 19, so they're covered by Alberta Healthcare. Alberta Healthcare also covers eye exams for anybody over the age of 65. If you do have any issues with your eyes in terms of medical issues, like your eyes red or your eyes itchy, or you have something in your eye, that's also covered by Alberta Healthcare, and it's called a medical eye exam. If you haven't had your eye health exam in the last few years, it's very important that you do get in. Like I said, it's not just a vision test, it's to make sure that the back and the front of your eye is very healthy. And if you do have any children that have not already been tested, also very, very important to bring them in as soon as possible, because if they do have any issues, usually if they're under the age of 8, we may be able to even rectify them. When you go to an optician to get your eyes tested, it's called a vision test. When you come to an optometrist, it's an eye health exam. And that's the major difference there. That word health is the most important thing. So you got to think of your eyes like when you come to get your eyes checked at the optometrist, it's like a physical for your eyes, right? So you get your physical done every year at the doctor's, come get your physical done for your eyes every year at the optometrist, not just a vision test.
Dry eye is something that affects many of us. Lots of people visit their eye doctor annually to find out about treatment for dry eye. Our tear layers are made up of 3 different components. That's water, oils, and mucus. And in order to have a healthy tear film, those 3 need to exist in balance. And when we start to have a deficiency of one of those tear layers, that's when dry eye occurs. So things like quick evaporation of tears due to a deficiency of one of those tear layers, or low production of tears due to a deficiency in those tear layers will usually be the reasons for why we have dry eye. So the key to treating and recognizing dry eye is to know what the symptoms are. So oftentimes a patient might come in complaining of burning, a bit of redness, sore eyes, feeling as if their eyes are always watering or they're always in and out of focus on the computer or while concentrating. Those are actually quite common symptoms of dry eye that sometimes get confused with other things, or somebody's thinking that there's a bigger underlying problem. The important thing is recognize these symptoms, come in and see your optometrist, have your eyes checked so that we can further test and sort of diagnose those symptoms and see if it is truly dry eye. So there's a lot of patients who are at risk for dry eyes, and sometimes that risk increases with gender. Women over 40 are generally a little bit more susceptible to dry eye. And a big risk factor is environmental conditions. So again, living in a dry climate, even within your home, having ventilation that is circulating dry air, those sorts of things will affect how dry your eyes are. Also, it can be sort of your everyday lifestyle. Do you work on a computer every day? Are you staring at a screen for several hours throughout the day? Those will generally cause, dry eye to be more likely within your eyes. So by seeing your optometrist, you're actually coming in to have a few tests done that are going to measure sort of how the integrity of your tear film and how quickly your tears evaporate. So there's several different tests that we can perform to measure the quality and quantity of your tears, because that will help us determine how best it is to treat your dry eye. I think it's quite important for patients to come in if they're recognizing any of these symptoms with grittiness, discomfort, burning, redness with their eyes. Come in and see your eye care professional, because we can diagnose and treat the symptoms before it escalates into a bigger problem.
Once we hit the age of 45 or beyond, our muscles along our lenses lose the ability to change shape, so we can't focus that near. So you can either get bifocals, so that they're going to have a line, and if you're looking above the line, you're going to see far. If you're looking below the line, you're going to see near. Or then you can get progressives. So essentially what progressives is, there's no line associated to them, so cosmetically they're more appealing. But now that you're compacting 3 lenses into 1 lens, you're getting unwanted prism and unwanted astigmatism on the sides. Along with the blurred vision or the blurred peripheral vision, you're also going to get what's called a swim effect. So a lot of people, what happens is when they're walking down the stairs, they feel like they're not straight, or when they're walking in a corridor, they're gonna feel the walls are coming down on them. Key things, knowing when you're pricing out lenses, you're just not looking at a price, you're looking at factors that are contributing to that. So the one is index of material, the coatings that we're putting on them, and most importantly, the design of that lens. So a common terminology that's used in the optical industry is digital. But now with this digital technology, it's basically a computer software that's taking various different measurements based on your prescription, your needs, and it's going to customize that lens for you. And now taking this back to progressives, the more you customize it, the more precision that's used to make these lenses, the wider that field of view is going to get, the less of swim effect you're going to get, and the better your quality of vision is going to be. Okay, now the key thing, as the index of material does start increasing, you're actually losing the optics, the quality of that lens. Now you need to go hand in hand. If you're going to go with the conventional design and you're going to go with a really high index of material, it's better to get a digital or free form lens that's going to compensate for that thin and that lighter lens. So there's various number of different coatings that we can apply onto lenses, but 2 of the key coatings are anti-reflective coating, which reduces all glare coming at you, which makes your vision more crisp, makes it more clear, and scratch-resistant coating. So it makes your lenses not scratch-proof, but scratch-resistant, so it makes it harder for you to scratch. But now quality is another essential thing with coatings as well. Depending on what type of a coating you have, they can wear off with time, but the higher the quality, the less likely it's going to wear off. The key part to coming in seeing an optician is getting your glasses fit and dispensed properly. When the optometrist dispenses their prescription, it is my job to be able to fit you with a proper frame. Looks nice, fits your prescription. Key to this is not every single frame is going to fit every single type of prescription. Okay? Once you find that frame, all the measurements need to be taken in relation to that frame. So you need that frame physically present there to get a proper fit of your glasses. If you don't have that frame, you're not going to have proper vision. The advantage of coming into a dispensary and seeing an optician compared to purchasing glasses online, you're not going to receive the same standard of care. There's a number of different factors that an optician would take into consideration compared to what online purchasing would do for you. As opticians are trained, we go to school for 2 years, we are regulated, we are licensed and educated in the sense to help you find a pair of frames and lenses to make sure that you can see properly, to make sure you are using your prescription that the optometrist prescribed to its full potential. It's important to know that The cost of your lenses isn't just a number. There's many different factors that go into contributing into that price. You need to know what type of lenses you're wearing, what the index is, what material is going, what design you're getting, because essentially you're not going to be looking through that frame, you're going to be looking through those lenses. And it's the lenses that's going to give you the clear vision and not the frame.
Macular degeneration, glaucoma, and diabetic retinopathy are some of the leading causes of blindness amongst North Americans and also all over the world. So one of the most leading causes of severe vision loss in the world is diabetic retinopathy. So that's changes to the blood vessels at the back of the eye. Often it's where your blood vessels leak and you have a sort of loss of the integrity of your retina. So this will often lead to very severe losses in your vision as well. Well, sometimes for many patients, they'll come in for an eye exam and you may not necessarily in the early stages have any signs or symptoms. So the important factor with diabetic retinopathy is treating it in its early stages. If we just let it go, it's going to cause sort of permanent losses in vision that cannot be reversed. So that is sort of the main concern with diabetic retinopathy. And then in cases where you do have those leaky blood vessels, we will do or send you for laser treatment. So that laser treatment is going to seal off those leaky blood vessels. But again, this treatment is most effective in the early stages. And the more that diabetes progresses and the more the retinopathy continues, the less likely we'd be able to treat it in any way. So it is important. Again, diabetics should be screened annually. So if somebody has diabetes, coming in for a regular eye exam, it should be at least once a year. So the macula is the central most part of our vision. It's where, it's the central part of our retina, responsible for us seeing detail, reading, recognizing faces. And when that starts to get damaged, that's when we call it macular degeneration. There's two forms of macular degeneration. One is the wet form and the other is the dry. Now the difference is that the dry form is slowly progressing and patients may not notice the symptoms of that as quickly as they would the wet form. The wet form usually progresses quite rapidly and those patients will pick up on those symptoms a little bit sooner. But the reason why it's so important to have this screened for or tested for regularly is, again, the symptoms or signs may not be there at the early stages. And again, macular degeneration is also one of those diseases that cannot be treated. If there is damage to your macula, we can only try to prevent it from getting worse, but we can't treat what's already been lost. So again, coming in for a regular eye exam is going to help us to diagnose and start to prevent progression of the eye disease. Also UV protection. UV damage is one of the leading causes of macular degeneration. So if you can do something as simple as just throwing on a good pair of sunglasses, even from a young age to the elderly, it's so important. You can really prevent those changes from happening. So glaucoma is thought to be caused by increased pressure in the eye. And that increased pressure affects the nerves that actually communicate with our brain. And that pressure goes up due to the fluid that circulates throughout our eye. When that pressure goes up and it damages those nerve fibers, it causes a loss of vision. So what people here are going to experience is usually a loss of their peripheral vision. And if you think about that, with both eyes open together, we often don't really always notice how far our peripheral vision goes. So it's very easy to not notice that you have a loss of peripheral vision. So glaucoma progresses very slowly in most cases. And if this is the case, then a patient may not even know that they have it. We use something called an OCT, optical coherence tomography. And what this does is it performs several little scans that actually show us the different layers of the retina, and sometimes it'll, if we want to just see what the optic nerve looks like, it'll show us any damage that's occurring in those layers or bundle fibers as well. So it's a great tool in diagnosing changes to your optic nerve and preventing the glaucoma disease from progressing, because again, it is one of those diseases that is, preventable, but once you have damage, that damage is irreversible. Lots of these leading causes of vision loss can happen without any signs or symptoms. So you may not be noticing it, but you might be affected by it. And the best way to actually find out is to see your eye care specialist.
A lot of us do not wear sunglasses, or we only wear sunglasses because we feel that it's bright out. And so we're usually only wearing them in the summertime because we're trying to get rid of the glare. However, it's very important that we wear sunglasses outside all the time during the daytime. UV is actually very harmful for our eyes. It can cause things like cataracts, age-related macular degeneration, pinciculi, and even wrinkles around your eyes. So it's very important that all of us are protecting ourselves from UV. And to do this, we need to be wearing good quality, keyword, good quality sunglasses to protect our eyes. You want to make sure it's 100% UV protection. Most optometrists may carry a machine where we can actually check how much UV is going through your sunglasses. So when you do go for your eye exam, you can ask your optometrist to check your sunglasses or your transitions for these things. So it's very, very important that you always do get maybe you may need new sunglasses every 2 years because those coatings do start to fade. Another reason it's also important to wear your sunglasses is in Calgary, there's snow on the ground almost half the year. And snow actually reflects more UV than when it's just nothing on the ground. So when UV hits the ground and there's snow on the ground, UV actually reflects back up into your eyes. So very, very important that when there is snow on the ground or when it is in winter, you should be wearing your sunglasses outside during the daytime. It's probably more important in the wintertime than it is in the summertime. Age-related macular degeneration is actually the leading cause of blindness in the Canadians over the age of 50. And one of the major risk factors is UV. So wearing your sunglasses can help prevent this to happen. And you know, as an optometrist, I'm all about prevention, right? Because so if you're coming to me when you're 30, I want to make sure that when you're 50, your eyes are still healthy and they're not progressing to get age-related macular degeneration. And there's certain things I can't control, like family history and if you do smoke and things like that. But the part of it I can control is UV and you wearing sunglasses. So I can say to you, it's really important, make sure you're wearing your sunglasses to help prevent age-related macular degeneration. And like I said, it causes your central vision to be lost. So imagine looking at something and so if I'm looking at a person, I just wouldn't be able to see their face. So it's your central vision that would be completely lost. So we want to make sure that none of us ever have to experience that. So if we can prevent some of that by wearing sunglasses, you should. Now, cataracts are a little bit different than the other eye diseases because it's not that you can't see, it's more like you're seeing through a film or a curtain. Some people do have some problems with seeing as well, but usually the first few symptoms are, oh, I'm seeing through a film or seeing through a curtain. Cataracts, we can take them out and replace your lens, but even the new lens is at risk if you don't protect it by wearing the sunglasses. It's also very important that children do wear their sunglasses when they're outside, probably more important than even adults because their lens is not fully developed. So instead of UV hitting their lens, it's actually hitting the back of their eye, which is called their retina and where you get your vision from. So it's very important that children are always wearing their sunglasses outside, and they are outside way more than most of us adults, so they're being exposed much, much more. So it's very important they are. It's always, the best thing to always do is get a good quality pair of sunglasses so you know that when you're cleaning it or doing other things with it, that the coatings aren't just tearing off or anything like that.
Contact lenses are actually quite a viable solution for a lot of patients who do wear corrective lenses or glasses. In the past, we often thought that contact lenses weren't for everybody, such as people with astigmatism where the cornea is not quite round, or people who have progressive lenses or bifocals and they're correcting their reading vision. Well, actually in this day and age, technology has come quite a ways in terms of being able to produce lenses that do correct vision for patients that range. So we are able to fit lenses for patients who now have astigmatism to a certain degree, as well as what we call multifocal lenses, which are for people wearing progressives or bifocal contacts. So with wearing contact lenses, it's actually quite important to have a proper contact lens fitting done. The assumption that everybody's eyes are the same or our shapes are the same is quite incorrect, and those contact lenses are actually made to fit a certain diameter, a certain curve. And so when you see an optometrist, for example, we are measuring your corneal curvature, looking at the power of that lens, compensating for certain things such as how high that power is, to actually fit you with the appropriate lens that's going to give you the best vision and the best comfort. When we sort of assume that it's okay to wear any contact lens, that's when we run into certain complications, such as a lens that's too tight fitting, too loose, and that's going to actually create discomfort and may actually cause a bit of damage to your cornea as well. So this is why we really emphasize the importance of having a fitting done and not just going to the internet to purchase contact lenses. It's quite important to do that. With wearing contacts, there's several different factors that are going to affect your comfort, mainly the type of lens that you're fitted with. Patients, we're going to try to figure out what type of activities they're doing while they're wearing contact lenses, whether it's just for sport, just socially, or while they're at work, or if they want to be wearing them every day, all day. And that's how we're going to decide the type of lens. Then we're going to look at things like their eye and how dry their eyes are, and what the condition of their cornea is to pick the particular lens that's most suitable to them. The more conventional lenses today are soft, sort of hydrogel lenses, and those can come in dailies, bi-weekly, monthly, extended wear, and these different modalities of wear all depend on how you're using them. The key point to keep in mind when it comes to wearing contact lenses is your compliance. So if you are wearing a contact lens, such as if it's not instructed to be worn overnight, but you are sleeping in those lenses, or you're showering in those lenses, or you're using them above and beyond the allocated time that you've been told to wear those lenses, those are going to create the most issues with you when it comes to comfort, but also the integrity of how healthy your eyes stay as a result of wearing contacts. People who abuse the use of contact lenses, or they don't comply with the instructions given by the optometrist, are more likely to develop certain problems such as neovascularization, and those are certain when we get little wispy blood vessels that form around the cornea and actually make it quite difficult for you to continue wearing contacts down the road. So these are things that we really have to pay attention to, and again, if you're purchasing contacts online, you're not going to get that information, you're not going to get those instructions. So seeing an actual optometrist is going to help to answer those questions and also instruct you the right way so that you don't develop problems with contact lens wear. We can all wear contacts, and we can wear them safely and appropriately as long as it is used in the way that you have been instructed.
So today we'll be talking about the different types of refractive errors that we deal with in practice. What I mean by refractive errors is at the end of your exam, your eye doctor hands you a piece of paper and says, here you go, fill this. And you see a bunch of numbers on it, and most of us don't even know what those numbers mean. Most people with nearsightedness see blurry in the distance and pretty good close up. What happens in someone that's nearsighted is light rays come into the eye. Instead of hitting right at the retina, they go right in front of the retina, causing this blur to happen in the distance. So what we do is we give them glasses or contact lenses which allow the light rays to come in and hit at the retina so things are clear. So in myopia, you will see a negative power in your prescription. So the first number you see may be a -1, a -2, a -3, or so on. So we also have something called high myopia. High myopia when the prescription is greater than -6. When you see that your prescription is greater than -6, sometimes this can mean that your eye gets longer and stretches, causing a retinal hole or a tear in your eye that may even cause a retinal detachment. So if you are someone that has a prescription that's larger than -6, make sure you're regularly seeing a doctor, and make sure that you're having regular dilations to make sure that you don't have a detachment or anything like that. Signs and symptoms that you may experience in myopia are headaches, strain, difficulty seeing in the distance. A lot of people may complain about not being able to see highway signs clearly. A lot of children don't even know if they have this because, they just assume that what they're seeing is what everybody else is seeing because they don't know the difference between blurry vision and clear vision. This is the term we use for farsightedness or longsightedness. So in farsightedness, you see a plus prescription. So when you look at your piece of paper, the first number will be a +1 or a +2 or a +3, etc. In farsightedness, when light rays come into the eye, instead of hitting at the retina, they go behind the retina this time. So the glasses and the contacts will correct this by going on the retina and allowing you to see clearly. Now, farsightedness is a little bit different than nearsightedness. In farsightedness, usually people have trouble reading and things like that. However, if you have a very high plus prescription, sometimes you can have trouble in the distance and close up. This usually affects about 5 to 10% of the American population, and myopia usually affects about 25%. So it's the most common, and this is the second common. So astigmatism basically means that your eye is shaped like a rugby ball rather than completely round. So people with astigmatism don't have that basketball shape, they have that football shape in their eye, okay? And when light rays come into the eye this time, instead of hitting one spot on the retina, they're dispersed all over. So astigmatism is also really easily corrected using contact lenses or glasses. On your prescription now, the astigmatism is the second number. So you'll have the first number, which can be a plus or a minus, and then you're gonna have a second number. And then beside that, you're gonna have another number, which is the axis, telling you where the astigmatism at. So if the last number is 180, it's right about here. If it's 90, it's right about here. You don't have to worry about all these things, it's just that they'll correct it easily with contacts and glasses. Usually people with astigmatism, they have troubles differentiating O's, C's, Q's, things like V's and U's, T's and P's, and once we correct them, it's very easily to be able to distinguish these sort of letters. And night driving is a big one with astigmatisms. A lot of people will come in and be like, I just can't see clearly at night. It's usually because the lights are all being dispersed everywhere. And once we correct this, the lights are not being dispersed and you can see much, much better. So presbyopia is a little bit different than the other three. It's age-related. So you may be someone that's gone your whole life and you have this perfect vision, but usually you can't run from this. It doesn't have anything to do with the light rays coming in. It has to do with the lens at the back of the eye. So we all have this lens at the back of the eye. When we're young, it's very flexible and it moves for us to be able to see close and see far away. But as we become older, it becomes less flexible. So a lot of people complain about not being able to see their phone or not having long enough arms to be able to see, the computer getting slightly blurry. It's hard to be able to read a newspaper and do things for a long time. So this is called presbyopia. And this is also very, very easily corrected with different types of things. Usually a lot of people will turn to progressives. Progressives are glasses with no lines in them, and you can see the distance, the intermediate, and the reading. The nice thing about progressive is you do have that intermediate range, which we use for the computer. So you get your computer and reading. On your prescription, if you have a look, so you'll have the first number, and sometimes you may have that astigmatism with the third number, and then you'll see this place called add. And you may see a number under there called +1 or +2. That is your reading prescription. And all of us, when we get a prescription, we should understand why we're wearing the glasses and what we need them for. So it's super important to ask your doctor these questions and understand why we're wearing the glasses or the contacts.